Good afternoon, and welcome to the New Year's edition of Direct with the Director. I'm Greg Foster, Director of Emergency Management for Nassau County, Florida. Just like everybody else, 2020 has been a difficult year for people in emergency management, with the Sheriff's Office, and with government as a whole in Nassau County. And I know it's been difficult for everybody on the outside of government also. But we have to remember that this pandemic does not go by our calendar, and that moving into the year 2021, this pandemic is still going to be there. COVID-19 will continue to be a danger, although the vaccine is coming, and we've spoke about that in previous editions. We still need everybody to take precautions, socially distance, stay away from large crowds. If you're sick, stay at home, and if you cannot socially distance, or for other reasons it's applicable to wear a mask, to wear a mask, and continue to be safe for yourself, your family, and your friends. Today we have Dave Richardson, our PIO from the Emergency Operations Center, here with me, and I believe we have some things to discuss. Dave?
How you doing, Director?
I'm good.
As we have done since Thanksgiving and Christmas, this is New Year's. We're going into 2021, so Happy New Year.
Happy New Year.
Let's start with something you just said. We're moving into 2021, but the pandemic is still with us.
It is.
We've seen an increase in cases in Nassau County.
Yes.
Our percentages are running higher versus the number of tests taken and the number of positives versus those number of tests. And we've seen up to 90, 88 a couple of days ago in Nassau County. Everybody's hoping vaccines will curb this pandemic at some point, but it's going to be a while.
Yes.
Is that why it's that important that we understand we still have to do all of these guidelines from the CDC to help protect each other?
Sure.
Explain that a little bit more, if you can, about why we're seeing this surge. Thanksgiving, Christmas, we don't know yet. It'll be coming a couple of weeks down the road. Why is this so important? Because the vaccines will be coming.
Sure. So the vaccines, like we've talked about before, are going to come out in phases. There are going to be certain segments of the population, certain segments of emergency services that are going to be getting the vaccine, be it people in nursing homes, ALFs, firefighters, EMTs, law enforcement, governmental employees, general public. It's all going to come out in phases. It's going to be a long-term rollout phasing, which means we're going to be getting into spring, maybe even early summer, before we have a massive rollout to the general public. So in the meantime, we're trying to get to herd immunity. And I know everybody's heard of herd immunity before, but that's what we're trying to get to. The number of people who have either had the virus or are vaccinated against the virus are a large enough segment of society to make it less likely that a person who does not have the disease will not come in contact with somebody who has the disease. That's kind of a simplified version of what herd immunity is. So as we go through this long-term rollout of the vaccine, people still need to wear masks when it's applicable. They need to socially distance. They need to stay away from crowds, because it's going to take us a little bit of time to get to that point. Even when they've been vaccinated, they still need to take precautions, because we are in the midst of flu season. And that's going to be an added stressor along with COVID-19 for the next several months until we get out of flu season. And hopefully we get to herd immunity in the general public to where this can start reverting back to a normal situation.
The Florida Department of Health is responsible for keeping track of the cases in Nassau County. And I'm making the assumption you may have heard directly from Dr. Seidel, for example. They've got to be overwhelmed right now with contact tracing.
Sure.
Explain a little bit about what happens when we see people show up at indoor facilities, 200 or 300 at a time for a concert, which was something that happened in Duval County.
Right.
But we've seen that here as well in Nassau County. Then somebody comes in contact with somebody and takes it home.
Right.
That's what we're seeing. We're seeing children 1 years old, 5 years old, 9 years old with significant numbers
Sure.
of those cases. How do we emphasize over and over and over how important it is until these vaccines reach the general population?
Sure. Well, it goes kind of along with what the CDC said in reference to traveling and getting into large groups of people for Thanksgiving. And of course, we did see a large surge from that. And we anticipate there's a possibility of a large surge after Christmas because we are coming in contact with more people. And then you have those outside factors like sports events, like concerts and other things that bring large groups of people together. Obviously, everybody's heard super spreader. As a term that's been used, people that are either more contagious or just spread it to more people for whatever biological reason. When you're in those large groups, again, you need to be wearing a mask. The guidance is socially distance, stay away from large groups, and if you can't, wear a mask. So you need to be wearing a mask, paying attention, washing your hands, using hand sanitizer, because if there is one person or a few people or a group of people in that larger group that have it, then your chances go much higher that you're going to wind up contracting the disease and then bringing it home to your loved ones, to your elderly parents or grandparents, to your young children from those locations. So it's again, we can't stress enough the importance of following those CDC guidelines. Like Christmas and Thanksgiving, we understand that people are going to get together. But if you're going to get together, take those precautions that's going to help keep you from getting it and then bringing it home to your family. Wearing a mask, outside as much as possible, not confined areas, use hand sanitizer, wash your hands. And if you start feeling like you're sick, then don't go to work. Avoid contact with other people until you determine whether you have the virus or not.
Let's talk about vaccines. Director, let's talk about vaccines then. A lot of people are hopeful that it will change the pandemic, but different groups in different states, and even in different counties and different locales, a lot of people. They're doing it by appointment in such and such a county. I'm over 65. I can get it in this county. When will people know? How will they know they're eligible to get a vaccine in Nassau County?
Sure, and that's a great question. I understand the stressors that come with people not knowing that information, and what I'm asking people to understand is that counties get the vaccine based on, with the Pfizer vaccine, on the ability to be able to store the vaccine because you have to store it at such a low temperature. A lot of the facilities in our jurisdiction can't keep it at that temperature, so that it's being stored in Jacksonville and being provided to the area. With the Moderna vaccine that's coming out, obviously it can be stored at a lower degree. But we're getting the vaccine in differing numbers depending on the population of the county, based on all kinds of factors. And what the public in Nassau County needs to understand is that when we start getting to that point where we're going to start targeted testing by age, by pre-existing conditions, the general public as a whole, we're going to provide that information out. It's going to be provided out through our social media sites, our Facebook page, our Instagram account, Twitter, next door. We're going to nixle it. We're going to put it out through Everbridge. We're going to put it on our website. We're going to provide it to our partners, be it in TV media and print media. We're going to provide that information out so that we can hopefully reach everybody in Nassau County to let them know it's coming up. Your time is coming up, and this is where you need to go, and this is what you need to do. Now, there's a lot of jurisdictions in the state of Florida, or I say a lot, there's a little bit more than 10% of the jurisdictions that have come out with, okay, on this date, which is in the future, it's going to be made available to people that are 65 and older, and there's a registration process that's going into effect. that is not a registration process that's across board across all counties. The counties are responsible for coming up with how that registration goes into effect. And if it's determined through the Department of Health that we need to have some kind of registration program, that will be provided to them also. They will be advised, this is where you need to register, this is where you need to give your information, this is where you need to show up at, and all the procedures to go along with getting the vaccine. All of that will be provided in multiple different sources through emergency management.
Well, as you said at the very beginning, this 2020 has been a difficult year for all of us. So 2021 is here. Again, Happy New Year.
Happy New Year.
And I guess the last thing you can say is be safe, be smart about what you do over the next couple of days.
Sure. It's exciting to get into a new year, and we all hope that it's going to be a better year, but let's do our part to make sure that that takes place and just be safe.
Thank you, Director.
Thank you.